21. Which of the following is a common physiological change that occurs during pregnancy? A. Decreased blood volume. B. Increased heart rate. C. Reduced uterine size. D. Lowered respiratory rate. Rationale: during pregnancy, the heart rate increases to accommodate the increased cardiac output needed to supply oxygen and nutrients to the fetus and maternal organs. 22. What is the role of oxytocin during childbirth? A. Stimulates uterine contractions. B. Relaxes the cervix. C. Inhibits labor progression. D. Decreases pain perception. Rationale: oxytocin is a hormone released by the posterior pituitary gland that stimulates uterine contractions during childbirth, promoting labor progression and delivery of the fetus. 23. Which of the following is a common sign of postpartum depression? A. Euphoria. B. Fatigue. C. Increased energy levels. D. Improved appetite. Rationale: fatigue is a common symptom of postpartum depression, characterized by persistent feelings of exhaustion, lethargy, and low energy levels following childbirth. 24. What is the primary source of iron for breastfed infants after 6 months of age? A. Breast milk. B. Formula milk. C. Solid foods. D. Cow's milk. Rationale: breast milk becomes an insufficient source of iron for infants after 6 months of age, so it's important to introduce iron-rich solid foods such as iron-fortified cereals, pureed meats, and legumes. 25. What is the purpose of the fontanelles in a newborn's skull? A. To provide flexibility during childbirth. B. To regulate body temperature. C. To facilitate brain development. D. To allow for brain growth and expansion. Rationale: fontanelles are soft spots on a newborn's skull that allow for brain growth and expansion during infancy, providing flexibility and accommodating the rapid development of the brain. 26. Which of the following is a common sign of dehydration in infants? A. Increased urine output. B. Dry mucous membranes. C. Excessive sweating. D. Rapid weight gain. Rationale: dry mucous membranes, along with decreased urine output, sunken fontanelles, and lethargy, are common signs of dehydration in infants, indicating a need for prompt rehydration and medical attention. 27. What is the recommended duration of exclusive breastfeeding for infants? A. 1 to 2 months. B. 3 to 4 months. C. 5 to 6 months. D. 7 to 8 months. Rationale: exclusive breastfeeding is recommended for the first 6 months of life, during which infants receive only breast milk without any additional food or drink, except for vitamin supplements as needed. 28. Which of the following is a characteristic of the transitional phase of labor? A. Active contractions and cervical dilation. B. Rapid cervical dilation and descent of the fetus. C. Intense contractions and urge to push. D. Complete cervical dilation and effacement. Rationale: the transitional phase of labor is characterized by active contractions, rapid cervical dilation, and increased discomfort, signaling the transition from the first stage of labor to the second stage of labor. 29. What is the purpose of the Moro reflex in newborns? A. To protect the airway during feeding. B. To facilitate breastfeeding. C. To initiate the startle response. D. To promote bonding with caregivers. Rationale. The Moro reflex, also known as the startle reflex, is a primitive reflex in newborns that occurs in response to a sudden movement or a loud noise, causing the infant to extend their arms and legs outward and then pull them back in a hugging motion. 30. What is the recommended age for introducing solid foods to infants with no known food allergies? A. 2 to 3 months. B. 4 to 6 months. C. 7 to 9 months. D. 10 to 12 months. Rationale. The American Academy of Pediatrics recommends introducing solid foods to infants around 4 to 6 months of age, when they show signs of readiness such as sitting with minimal support, showing interest in food, and losing the tongue thrust reflex. 31. What is the primary purpose of the cervical mucus plug during pregnancy? A. To prevent urinary tract infections. B. To protect the fetus from infection. C. To lubricate the birth canal. D. To stimulate uterine contractions. Rationale. The cervical mucus plug acts as a barrier between the uterus and the external environment, protecting the fetus from infection by preventing the entry of bacteria and other pathogens into the uterine cavity. 32. Which hormone is responsible for initiating lactation in the postpartum period? A. Prolactin. B. Oxytocin. C. Estrogen. D. Progesterone. Rationale. Prolactin is the hormone responsible for stimulating milk production, lactation, in the mammary glands during the postpartum period, triggered by the removal of colostrum and continued breastfeeding. 33. What is the primary cause of colic in infants? A. Gas and intestinal discomfort. B. Overfeeding. C. Lack of sleep. D. Teething. Rationale. Colic is characterized by excessive crying and fussiness in infants, often attributed to gas and intestinal discomfort, although the exact cause is not fully understood. 34. What is the recommended method for introducing allergenic foods to infants to prevent food allergies? A. Avoidance until 12 months of age. B. Gradual introduction starting at 4 to 6 months of age. C. Early introduction at 6 months of age. D. Delayed introduction until after 12 months of age. Rationale. The latest guidelines recommend introducing allergenic foods such as peanuts, eggs, and fish to infants starting at around 6 months of age to reduce the risk of food allergies. 35. What is the primary purpose of the Ballard score in newborn assessment? A. To assess neurological development. B. To evaluate respiratory function. C. To determine gestational age. D. To measure birth weight. Rationale. The Ballard score, also known as the New Ballard score, is a method used to assess newborn maturity and determine gestational age based on physical and neuromuscular characteristics.